All right, good afternoon, folks. Thank you so much for joining us. We're going to go ahead and get started now and let folks filter in as they can. Again, good afternoon. My name is Dan Callahan. I am a communication specialist with the Board of Animal Health. I will be moderating today's session. You may notice that you are muted as you entered. If you have questions, please feel free to drop them in the Q&A box, and we will address them both as we move through the presentation and also at the conclusion. We'll have some time for Q&A. This session is being recorded and will be available for review for those who were not able to join us on our YouTube channel, hopefully within the next few days here, but definitely by next week if you want to grab a refresher on that one. Also, if you're interested in looking at it or reviewing any of our previous companion animal webinars, there's a whole series there. Please join us on YouTube. You can actually review all of those previous sessions. All right, with that, I think that's all the bookkeeping out of the way. Let's go ahead and get started. Dr. Steve, take it away.
Thank you, Dan, and thank you everyone for being here, taking time out of your day. And my name is Steve Kivisto. I am a veterinarian with the Board of Animal Health. I'm the senior veterinarian, and I work in the companion animal programs. And today we'll be talking about some intestinal parasites. And with that, I think maybe we'll just jump right into it here. Some of the more common ones that I think most people have heard of and you're probably dealt with quite often, your roundworms, your hookworms, your whipworms, and then lastly, your tapeworms. These are I guess, our most favorite parasites, the ones that we're going to see on a regular basis. We're going to spend a good deal of time, particularly on the first three, the roundworms, hookworms, and whipworms, because they have a little more of a complicated life cycle, and you're going to see them more than the latter two. And then there are some common protozoans that, Giardia, Coccidia, Trichomonas, Toxoplasma. When I was throwing this together, my intention was to go through those as well. It became apparent as I was making slides that it would have been very difficult to get through all of these and do them any justice. So for those of you that were really looking forward to a conversation on Trichomonas today, I apologize, but I think maybe we can do is just make it a separate intestinal parasite webinar covering the protozoans and others that maybe we don't hit. So from there, just some terms that I think are helpful to know, at least have some basic understanding when we're talking about intestinal parasites. I'll just kind of go through this list here with you. The pre-patent period is basically the time between when an animal is infected, ingest the eggs of a parasite, to the point where it becomes adults, and then we can detect that adult parasite in the animal. In the past, that detection would be usually looking for eggs. Now, in a stool sample, the advent recently over the last 3-4 years or so of antigen testing or DNA testing for intestinal parasites, rounds, hooks, whips, the whole shoot and match, has kind of thrown what we would traditionally look at as pre-patent periods for a lot of these intestinal parasites right out the window, as you're going to be detecting DNA before you're going to find eggs. So for those who are able, if you're working with a veterinary clinic and you're looking to maybe up your game on parasite detection, the many labs, IDEXX, NTEC, some others, do DNA testing of stool samples looking for intestinal parasites. My experience has been that it's not really that expensive, so probably worth that extra expense if you're looking to catch more. Next, zoonotic is just basically any infection that is typically found in animals that can be transmitted to people. And so some of these intestinal parasites can affect people in one way or another. The next few terms, transplacental, transmammary, transdermal, I think the names kind of give them away, by the placenta, through mammary tissue, or through the skin. Some parasites, not only your next one, fecal oral, can not only be passed that way through just ingestion of the eggs. But when the pups are still in utero or after they're born and nursing, some of them can get it that way. And in the case of hookworms, we can see transmission through the skin. And then the last two, the intermediate hosts, this is an animal or some other kind, whether it's an insect, a host that is necessary for the parasite to continue its life cycle. Without it, it won't be able to do so. Contrast that with a parentenic host. That is a host that can transmit the parasite from one animal to the next, but isn't necessary. It's kind of an accidental host, if you will. So just some basic terms there for us. So let's get started with roundworms. I think everyone's pretty familiar with them, probably have seen them at one point in time. The spaghetti worm, as I like, well, I think most of us like to, well, maybe not like, but we'll refer to it as. It can be up to 5 to 7 inches long. The adults, oftentimes animals with a good worm burden you might see them vomit them up, or they might be found in stool samples just crawling around. So on the left there is the adult example of it. To the right is a larval stage, which is microscopic. And then below both of those is a sample of the eggs that we would find. And both that larval stage and those eggs, those are images taken from a fecal sample or a fecal float. So in the simplest terms, the life cycle for most parasites, right? You have an adult, it lays eggs, the eggs are passed. The next host grabs a hold of those eggs in one way or another, and those develop again into adults. But if you look down into the nitty gritty of it, there are some, I guess I'll use the term, interesting things that can occur. So starting with roundworms, so you have your adults within the host. Those eggs are passed in stool. Once those eggs are in the environment, so they're in the stool sample or the feces on the ground, or maybe it gets broken up, the eggs are spread out a bit, those eggs are not immediately infective. So as nasty as it sounds, if a dog or a cat were to ingest those eggs right out of the oven, if you will, they are not going to be able to develop into adults at that time. They'll just pass through. They'll go right on through the intestinal tract and out the other end again. Those eggs need to embryonate or develop into larvae, have the larva develop within the egg, I should say. So once those eggs larvate, then they are infective to the next host. So if the new host comes along and happens to ingest the eggs, whether that be just walking through soil and licking their paws, eating stool, whichever it happens to be, if those eggs have larvated, then they will be infective. So once those larvated eggs are ingested, they will hatch within the intestinal tract. And this is where you would think, well, then why not just set up shop while you're sitting there? Well, because nothing is easy, I guess, even in the world of intestinal parasites. So the next thing they're going to do is they're going to enter the wall of the intestines and then get into the bloodstream. They find their way to the liver, to the lungs from there, and then to the alveoli, or the smallest little pockets that we find in our lungs where oxygen and carbon dioxide are exchanged. So once they get into these alveoli, they will bust through. And from there, some of them will get coughed up, swallowed, and then they get back to their way down into the intestinal tract, and they develop into adults. Others will re-enter the bloodstream through the alveoli, and they will migrate to other body tissues and encyst. Basically, they'll become little cysts in muscle tissue or the liver, reproductive tissue or whatnot, and they basically go to sleep, hibernate. They just hang out there. So if you have an adult dog, male, female, and they happen to be spayed, in the case of a female, or in the case of a male, they could be intact. that would be the end of the story. Then they live out their lives happily with encysted roundworm larvae within their tissues. And if they had adults in their intestinal tracts, you would treat them, you would eliminate them, and that would be the end of it. Where it becomes complicated is when you have an intact female, because when the female becomes pregnant, these encysted larval stages then become reactivated. So this is where it gets to be kind of confusing for some people. They might have an adult dog, a female, where at the time of pregnancy, she'll have a negative stool sample. There's no eggs in there. Even you can even have a negative DNA test for that matter. But then once she has pups, the pups end up having worms, or she ends up having worms all of a sudden, and then that can be confusing for some people. But the reason why is what's happening once the pregnancy occurs, hormonal signals tell the larval stages to reactivate. And so these larval stages then they will make their way through through the bloodstream. Some of them will set up shop within the intestinal tract of the mother. Others find their way to mammary tissue, and some of them will go directly, in the case of the dog roundworm, directly from the bloodstream right into the developing fetuses, and find their way into their intestinal tract. So this is why it's possible when we are very young pups for them to have roundworms already. Now, just as kind of a looking at this on a diagram, the red circle is your kind of your straightforward version of it, right? Eggs passed. The second egg there is one that has a larval stage within it, so it looks like that little larva just crammed inside the egg still. That dog ingests it, and then the cycle continues from there. The rabbit there, that would be a parentenic host. So in the case of this bunny in this picture, it may ingest that larvated egg. That egg will find its way into tissues, but it can't develop into an adult. The bunny would be a dead end host in that sense. So if it's never, as the next picture shows, if it's never ingested, that's the end of it. Those cysts just stay inert in the bunny, and it lives its life with that. In the case of the dog that ingested the bunny with the encysted larvae, now it's become infected with roundworm, and then the cycle continues from there. So the female there with the nursing pups, that would be example of another way where again those pups are just they're coming right out of the oven, or as they're nursing they're developing roundworm but before they have a chance really to start to grow. The dog looks a little guilty there, the bunny in its mouth, I've noticed. So some differences between dog and cat roundworms, I mean, other than the name Toxocara canis versus Toxocara cati, transplacental transmission is one of the primary routes of infection in dogs. We don't see that in cats necessarily, but we can see transmammary transmission of Toxocara cati. Again, not as common as what you'll see the dog roundworm infecting dogs through the mammary tissue through nursing, but it does happen. Cats are more likely to get infected with roundworms by ingesting that parentenic host, killing that bunny or the mouse or whatever animal it happens to be. And so therefore, we will see more roundworm infections in adult cats than dogs. And then just by the nature of the fact that, if you've got an outdoor cat and it hunts, it's got a decent chance of picking up a parasite that way. Clinical signs generally in an adult dog or cat, more often than not, you may not see anything other than if they have a large enough worm burden, they might pass, again, adult worms in the stool, or you might find eggs on a stool sample, on a fecal float. But usually they're not life-threatening. I guess one of the other things you might see is like maybe a poor hair coat if they've got a large worm burden. The unusual clinical sign that you might see is as those larval stages are migrating through the lungs, they can develop a cough, and it can almost be like a asthmatic, sort of a dry hacking cough. Young puppies, kittens with high worm burdens, I mean, they certainly can have diarrhea, vomiting, lethargy, poor hair coat. It's not unheard of for obstruction with large worm burdens. There's something called intussusception, where the small intestine can kind of, I would say, loop inside of itself. That can be associated with high worm burdens in puppies and kittens. So again, like I guess many things, the young tend to get affected by things worse than the older, more adult animals. And again, so this pre-patent period of 2 to 4 weeks. So after ingestion of the egg or reactivation of the larva, it can take anywhere from 2 to 4 weeks to start seeing eggs in the stool sample. But again, once you start having and I wasn't able to really nail down a great time frame for when that DNA test can pick up, but my understanding is it's probably half that time, maybe a week to 10 days to detect adult worms with a PCR test. So zoonotic potential. So there certainly is. Now, people aren't going to get an adult roundworm from dogs or cats. The problem is once those larvated eggs. So again, one can eat all of the non-larvated eggs they want, and they're not going to become infected. But if a human happens to ingest a larvated egg, it's those larvae, once they hatch, they are going to work their way into the tissue. They're never going to find their way to the intestinal tract. And the problem we find is with these larval migrations. So a condition called visceral larval migrans, where the larval stages are working their way through organs such as the liver. Now, a few larvae working their way through the liver really aren't going to cause much of an issue in an adult. One of the I guess worst case scenarios what was called ocular larval migrans. So they work their way into the back of the eye and wander their way through the retina. And in that situation, and it can take years after exposure for that to develop, it certainly can lead to blindness. So this is where if a person has a dog or a cat, cleaning up stool regularly, making sure the animals are dewormed regularly, just taking some basic precautions can help prevent that from occurring. But it's definitely worth noting that there is some potential. We may not get adult worms, but almost be better if we did versus something like ocular larval migrans. So that would be roundworms, and of the worms that we're discussing today, is probably, just given the life cycle, the most complicated one. The next one would be hookworms, and on the left there is a picture of eggs, again in a fecal sample of hookworm. And this is the mouth parts of the worm itself, and you can tell by just looking at those mouth parts, this worm grabs a hold, bites the lining of the intestinal tract. And while it's doing that, that's how it keeps itself in place, and it feeds on blood. So again, starting off simply, the infected hosts, the adult worms, lay eggs within the intestinal tracts. The eggs are passed in the stool sample. Once the eggs are in the environment, in about a week, the eggs will hatch. So here's one little difference between hookworms and roundworms, is those larval stages leave the eggs in the environment. So they are a little more susceptible to environmental influences than roundworms would be. So those hatched larval stages are just hanging out in the environment, waiting for the next host to come along. And once that host, and that could be again a dog walking through the yard, licking its feet. There's also the potential, as we'll discuss in a little bit, for the larval stages to work their way through the skin. So that's where you get transdermal or cutaneous larval migration. So some of those adults then, I should say, some of those larval stages, they'll work their way to the small intestines. They enter the intestinal wall. They mature within the intestinal wall, and then they reemerge in the intestines as adults. Others, and who knows why some of them decide to do it and some don't, others will enter the bloodstream after they penetrate the intestinal wall, and again will make their way to the lungs. So then these will erupt through the alveoli. Some of them will re-enter the bloodstream and encyst in tissue, much like roundworms. Others will be coughed up and swallowed and then become adults within the intestinal tract. So some similarities there between hookworms and roundworms and the fact that we can get encysted larval stages waiting for certain signals to happen. What we don't see in roundworms that we do see with hookworms is this transdermal infection. So the larva can penetrate the skin upon contact, get into the bloodstream, work the way to the lungs, coughed up, swallowed, and then into the small intestine. And so, but again, some of those larval stages can enter the alveoli and the blood vessels and travel to muscle and organs where they become encysted. Those encysted larval stages will become reactivated under one of two conditions, either whelping, so the birth of pups, or larval leak. And in the case of whelping, the larva will then work their way to the mammary tissue and infect the nursing puppies. So, and again, another difference between hookworms and roundworms, we don't see transplacental transmission in hookworms that we do in rounds. But we can see mammary transmission. So nursing pups can pick up through the mammary tissue. Another interesting, I guess, I'll use that term, fact with hookworms is a process called larval leak. So when adult worms are eliminated, so you have a dog that has an adult hookworm infection, you're finding hookworm eggs on a stool sample. Those encysted larval stages will reactivate once the adults are eliminated. So there's obviously some sort of chemical signal between the adults and the encysted larvae. Once that signal is eliminated, then it's basically like saying, hey, there's room, come on in. And then those larval stages will reactivate. So this can lead to continuing egg shedding even after treatment. So it can be frustrating for veterinarians, owners, caretakers, where they feel like, man, we've been treating this dog over and over again for hookworms. We get a negative stool sample, but then, we check another one in a month or so and it has hookworms again. And, people swear up and down that they're cleaning the environment better. They're giving the dewormers like they're supposed to. Fingers get pointed. But in fact, it's biology. It's just the way this particular parasite can work. Now, if you continue to treat the adults and you eliminate the larval stages from the environment, sooner or later, you're going to run out of encysted larval stages. But, we're probably talking hundreds, if not thousands. So you can imagine that might take a bit of time. This is a kind of a cluttered life cycle diagram, but I guess one of the points of it being, well, a couple of them being, again, you can see the little larval stages kind of working its way out of the egg while it's still in the environment. And then the little arrow pointing to the human foot, which is a foreshadowing of what's to come in our little discussion here. And then there's another little arrow pointing to the dog foot and pointing to the dog mouth. So all those are ways that hookworms are going to infect an animal. Clinical signs, there's kind of, I guess we'll say, 4 recognized, the worst of which tend to happen in the very, very young, the newborns, and those with large worm burdens. And really, it's all comes down to the fact that these are blood-sucking parasites. They're worms that feed on blood. So in a per acute a clinical condition. We have a Germanic anemia. It's usually associated with newborn puppies, so they're under a week of age. So these are going to be pups that you're not going to be picking up eggs in a stool sample yet, but those adults they're starting to feed already. And this can be a life-threatening problem because, again, the anemia can show up before the eggs are even found. So kind of a heads up to those who ever deal with anemic kittens. If you do have a negative stool sample, don't forget deworming is never a bad thing to do. In an acute situation, you'll still have anemia. It's not as dramatic. It usually tends to be in older pups. It can be life-threatening if not treated, but at this point in time, you're going to see some eggs in the fecal sample. So you're going to have more of a clue that this potential hookworms are contributing to that anemia, if not the main cause. Your compensated situation, these are adult dogs that have hookworm infections. They tend to be a little more resistant to infection. They can get more on board. They have more surface area in the intestinal tract. They have more tolerance for blood loss than something that's, a tiny little puppy would. But then you're decompensated. This would basically be these adult dogs that were at one time compensated, but then something else happened. Maybe they've developed cancer or kidney dysfunction or something that can make anemia worse. So, but in these latter three, the acute compensated or decompensated, there's a fairly decent chance that you're going to detect eggs if you do a fecal sample. And the per acute, you're not going to find eggs. I believe, though, it is possible, particularly if you're kind of at that later 7 to 10 day mark in these animals, those puppies with the per acute, you might detect it with that PCR test, the DNA test on a stool sample. And in case I hadn't mentioned it, that's what the DNA test is being performed on. It's not on blood, it's on the stool sample itself. So zoonotic potential, in people, it's generally how it affects the skin. So there's just an example of a person who's probably walking around on a beach and they happen to step on a larval stage or multiple larval stages and develop what we call creeping eruption. This kind of looks like, kind of as the name implies, like the larval stage is just working its way around within the dermis. And the reason is it's not leaving the skin is because it's in the wrong species. So it's lost. So it's just wandering around until it dies and the immune system takes care of it. Cats, you do see hookworms in cats. It's nowhere near as common as you're going to see in dogs. They do have their own species, but generally they can also get infected by the same species that infects dogs. Yeah, if you're going to see clinical signs, it's going to be ones that, again, they are severely affected. You might see weight loss, anemia, poor poor coat quality, vomiting, diarrhea, and potentially skin irritation, especially, again, because dogs and cats are walking around usually on their paws and the rest of their skin tends to be furred, so that can act as a barrier for these larval stages. So irritation on the paw pads or in the skin between the pads, you can certainly see some indication of hookworm larval migration there. So hookworms, roundworms, certainly some complications in their life cycle, not necessarily straightforward. Whipworms, however, are very straightforward. You have your eggs here on the left, and you kind of guess where the name comes from, though because of the whip-like structure on the worm. That's the adult on the right there. So very straightforward. You have a dog. I'm going to go with dogs. It's much more common in dogs with adult whipworms within its intestinal tract. They reproduce. They lay eggs. The eggs are passed in stools. These eggs can survive in the environment. Very hardy. They can last out there for a number of years. The eggs mature into an effective larval stage in the environment. And once this is ingested by the dog, the larva develop into an adult whipworm in approximately 3 months. But due to the long period of time to develop into adults whipworms, we don't usually see those diagnosed in dogs until they're closer to 6 months of age. And the other part of that is they're not picking up whipworms through nursing, and they're not picking it up transplacentally. So they're only getting it basically in the environment, fecal oral. So I like this life cycle, very, very straightforward again, right? The eggs are passed in the environment, they hang out there, they larvate, they're ingested, and the life cycle continues from there. Clinically speaking, infections with whipworms, the clinical signs are due to the worms burrowing into the lining of the large intestinal wall. So they work their way in there to hang on, and then the other part of them hangs out into the large intestine and is basically feeding in that way. So you typically will see signs of large bowel diarrhea, mucus in the stool, or maybe blood, straining to defecate, which for those who aren't aware, clinically speaking, large bowel diarrhea, a lot of times you'll get phone calls from clients that believe that their dog is constipated because it's out in the yard, it's straining, and maybe just small amounts are coming out. If you inquire further, you might find out that, yeah, there's drips of mucus, maybe blood, and small amounts of stool. They could be constipated, but more often than not, they're dealing with a case of large bowel diarrhea. And it doesn't have to be from whipworms. It could be from anything that can cause lower intestinal tract irritation. So again, that's straining to defecate, weight loss, and you may not see bloody diarrhea with that. You might not know. You don't always see blood in the stool with whipworm infections. And it can mimic, a good case of whipworms can mimic a condition called hypoadrenocorticism or Addison's disease. And those dogs will have kind of off and on diarrhea, maybe bloody stool. They can have signs of off and on weakness, inappetence. So it can be similar to that. All the more reason to check stool samples, right? When we have dogs or cats that are ill. Sometimes it just gets overlooked and forgotten. Cats are much, it's really, really uncommon to see whipworms in cats. They have their own species. The dog whipworm doesn't affect cats. I don't know that I personally have ever seen one. It's certainly possible I've missed one or two and over the years, but generally, if they do have whipworms, there's only a couple in there and they're not showing clinical signs. But if they do have enough, much like dogs, the straining, frequent bowel movements, fresh blood or mucus, severe cases, weight loss or anemia. So I guess the nice thing about whipworms, I suppose, is that the life cycle is pretty easy to remember, very straightforward. And the take home there is that it's unusual to see it in cats. So tapeworms, there's really two major main tapeworms that we'll see in dogs and cats. Your Diploidium, which is your flea and louse tapeworm, and then your Tinea species. And Tinea is the species of tapeworm that dogs and cats pick up from eating, from hunting, from eating animals, eating mice, rodents, whatever it happens to be. The key with tapeworms is that they need an intermediate host to become infective. Without that intermediate host, the eggs from a tapeworm are not infective to the adult animal. As nasty as it sounds, an animal could eat the segments of a tapeworm that's recently passed, directly from a dog or cat, and they will not develop an adult tapeworm infection. It has to go through the intermediate host. And again, in the case of Diploidium, that would be fleas and a lesser extent lice, and tinea. It depends on the species, but again, most cases we're talking cats, barn cats, and mice. That's what I always think of. So Diploidium, the life cycle, it looks really complicated, but that's because they threw the human in here. But it's pretty straightforward in the sense that you've got these on the right hand side, the segment on the top, and the example of the egg on the bottom. If you may notice, that egg looks very similar to hookworm eggs, but if you were looking under a microscope, that egg is much, much larger than a hookworm egg. So those segments are passed out in the stool sample. They are ingested. In the case of Diploidium, flea or lice will ingest those eggs. Those eggs develop within the flea or louse. Then that flea is ingested by the dog or cat, and then that will then those cysticercids, they will then develop into an adult within the intestinal tract. Without that intermediate host, it's not happening. So tinea, similar again, ignore the person. Life cycle just needs that intermediate host. The difference being it's an animal. It's not a flea, it's not lice, it's some sort of animal that's ingested that egg. So tinea, the eggs look again a lot like roundworm eggs. I shouldn't say again, they look a lot like roundworm eggs, but they have a much thicker cell wall. And then these body segments here of a tinea, a tapeworm. From my understanding, and I don't know, you can tell the difference between tinea and Diploidium by the segments, but most of the time when we're seeing segments, they typically are dried up on the back end of the fur on the dog or cat. Once they get dried up, the differences between the two of them it's impossible to tell. But you can take a segment of that tapeworm, squish it on a slide with some just even tap water, and there's a decent chance you'll knock some eggs out of that segment, and then you can identify it that way. And this is just an example of some of those segments here. Once they pass, they'll kind of wiggle around before they dry out. And once they dry out, then it looks like grains of rice, usually stuck to the fur, but they be sometimes a really bad case of it. You'll find it in the bedding where the cat's laying. I always say cats because that's what I think of when I think of tapeworms more often than not. So fun and nasty. Most dogs and cats with tapeworm infections aren't going to be showing you clinical signs. They're pretty, I'll say, harmless. It's gross, they're nasty, but they usually don't cause any outward signs of illness. Typically, people are just seeing the segments and they're rightfully so grossed out. But you can see weight loss or poor coat condition, vomiting, diarrhea. Any of those things are possible, but again, usually it's diagnosed by the fact that someone's seeing the segments on the perianal area or within the environment where the animal hangs out. Zoonotic potential. Diploidium can infect people if we accidentally ingest the fleas. It would be not impossible, but pretty hard to accidentally ingest the lice. But the fleas, they can live in the environment. They hop around, and if you happen to have your mouth open at the wrong time, you certainly could ingest one. But again, remembering it's not directly infected from a cat or a dog. They're gross, they're icky, the segments are no fun to look at. You're going to want them gone as soon as possible, but they're not infectious to you. There's tinea. The tinea species can infect people. It's typically eating meat, but this tinea species that infect people is not the one that's infecting dogs and cats. The dog and cat one will not infect humans. We have our own very special tapeworm, which is pleasant. And here it is. It's from pork. It's from eating undercooked pork. And the issue comes where if we have these, if a person does happen to ingest uh, uh, the eggs or the segments, the larval stages from um, the tinea tapeworm, the one that affects pigs, those can get into the human and insist in our muscle tissue or in our brain, and that can obviously be a problem. So the way they become adults is when we eat the undercooked tissue from the pig itself. They won't become an adult in the way in the first part of that, but the larval stages infecting your brain are something to be frowned upon, I would think. But again, not coming from dogs and cats. So, having said all of that, obviously there are ways to get rid of intestinal parasites, and there's many different ways. Pyrantel or Strongid used quite often. Many shelters, humane societies, rescues, breeders will use Strongid as part of their deworming regimen. Which is great. It'll get your hooks and rounds. Those are the two most common ones, but it won't get your whipworms. And it also, it won't take care of tapeworms, either version of it. Fenbendazole, Panicure, either in the granules or some clinics, again, some shelters, they will get the big bottle of the horse dewormer fenbendazole and use the suspension version of it. That will get your hooks, rounds, and whips, and your tinea species tapeworms, but not Diploidium. Praziquantel will get tapeworms. Drontal Plus will have praziquantel in it along with pyrantel. So it will get a few different species of worms there. But praziquantel alone will not touch hooks, rounds, or whips. It'll just get your tapeworms. There's a lot of combo treatments out there. Many oral heartworm preventatives will have some sort of intestinal parasite coverage in it. Typically, probably one of the more common would be pyrantel. You think HeartGuard or Iverheart. So keeping in mind, it's not getting all of them. And then there are certainly some topical ones like Profender, NexGard Combo, Revolution Plus, and the list goes on. There's more coming out, it seems like every other month. The trick is to know what they treat and how often to use it to treat it, keeping in mind that let's talk about this quickly. So eliminating from the environment, roundworm eggs are extremely resistant to common disinfectants, including bleach, that the egg itself, the wall protecting the larval stage, is very, very resilient. Has a sticky outer coating, which makes it difficult just spraying down a kennel or a cage. It can be difficult to get that egg to dislodge from surfaces. I have read that potentially bleach can affect the ability of the egg to be sticky. Doesn't necessarily kill it, but it might help you get it washed off the surface. Hookworm eggs and larvae are much more susceptible than roundworm eggs. Keeping in mind, part of this is because the larval stages will hatch out of the egg, and then the larval stages are more susceptible to, again, bleach, hard freeze. Stepping back with roundworm eggs, prolonged exposure to sunlight. So if you have a backyard that's mostly dirt, or maybe you got a sandbox that unfortunately got visited by a cat or a dog, raking it frequently to bring up to the surface any eggs that might have been buried. The UV exposure from sunlight can over time eliminate kill the eggs or the larval stages. A good hard freeze will kill the hookworm larval stages. Soil contamination from whipworms will be contaminated for years. It's almost impossible to remove eggs from soil or to kill them in the soil. So your best bet is to just make sure the environment isn't getting contaminated in the first place. And if you've got a dog that has a case of whipworms, developed whipworms, frequently deworming it just on a regular basis, because it's more likely to continue to get infected otherwise, and killing those adult worms before they have a chance to develop eggs. That's about the only way you're going to break that cycle. So takeaways from this, the parasite like life cycles, it can make them tricky to prevent, diagnose, and eliminate. And it can also make them very frustrating, right? And going back to hookworms, when you kill adults and then you get that larval leak, and then you're like, why is this happening? I try to treat them. So frequently deworming is very important for that reason. And the other fact is, dewormers will not kill the larval stages, whether they're encysted or they're circulating. It's only going to get the adults. So you have to, if you're deworming, let's say a puppy or a kitten, you're killing those adults, but then, a couple of weeks, the larval stages are going to become adults themselves, and they're going to start producing eggs. So that's why we're hitting these little squirts with dewormer, every couple of weeks, every 1 to 2 weeks, frequently, until they get to be, 12 weeks old or older, just to make sure that we're getting all the stages as they progress through their life cycle. Most puppies and kittens are going to end up with intestinal parasites, even if a person swears up and down that that mom did not have worms when she got pregnant, and she very well may not have had. They're more than likely, when she was a puppy, she was infected, and those larval stages insisted in her even as a pup. And then she became pregnant and they reactivated. And so it's always best to assume, regardless of where they came from, that a puppy or a kitten has intestinal parasites. And continuing to find eggs in a stool sample does not necessarily mean treatment failure. It doesn't mean your veterinarian did something wrong. It just means that they have a complicated life cycle, and it's important to know what that life cycle is so you know how to treat them, and which dewormers are going to work against which intestinal parasites. The overall theme of this being prevention is the best medicine. So using those heartworm preventions, even year round, there's no mosquitoes in the winter months, but intestinal parasites, and we learned that those hookworm eggs are very hardy in the environment, so potentially infect an animal any time of the year. And they're super safe. So giving a dog pyrantel, a cat pyrantel, isn't likely going to cause them any adverse side effects. I think the worst I've ever typically seen from dewormer is soft stool for a day or two. And even that's not that horribly common. So prevention is, with so many things, but for sure with intestinal parasites, your best medicine. A few as a kind of resources for really good resource for intestinal parasites, or just in parasites in general. This Companion Animal Parasite Council has a great, if you go to their website, a lot of different information on parasites, life cycles, treatments, zoonotic potential. Veterinary Partner is a website which has a lot of good articles on many different things. If you put in roundworms or hookworms in the search bar, you'll get a lot of good information, but you can find information on many diseases and disease conditions and infectious or whatnot. And it's free. And then this Today's Veterinary Practice has a lot of really good articles there too. So a lot of the information that I got for this presentation came from a combination of these 3 sites. And I would encourage you, if you do have any questions, either reach out to your veterinarian or do a little digging and a little research on some of these sites. And the Companion Animal Parasite Council, really its main focus is, well, twofold: prevent parasites in animals, and then prevent the zoonotic spread to people. So having said that, that is what I have for you today. It felt like kind of a blur. That's why I knew I wouldn't be able to touch on those protozoan parasites today. figured it would be kind of a time crunch. So with that, any questions pop up, Dan?
Yes, we do have one question. And again, folks, if you do have questions that you'd like Dr. Kivisto to address, please drop them in the Q&A box and we'll get those going right away. The first question we have here is it definitively hormonal signals and or is it the immune suppression of pregnancy that allows these larval stages to become reactivated?
So and that's a very good question because I had the very same question, and I found the reference to hormonal signals, but I will not sit here and tell you that the other part, the immune system part that you discussed, is not a factor in that. And just to make things even more complicated, it's just honestly, just in the interest of full disclosure, depending on what source you look at for hookworms, one would indicate the encysted versions are the larval stage will encysted through cutaneous infection only, and the adults are going to form through ingestion. So the point of telling you that, which seems to have nothing to do with your question itself, is to let you know that I am not the all-knowing person when it comes to intestinal parasites. A lot of it was remembering as I went back, stuff I learned in school a couple, 2-3 years ago, which is why I would really encourage, if I don't have the answer you're looking for, looking at those websites that I had mentioned.
Okay, well, that is the only question that we had submitted today. If folks do have questions, we'll take another minute here while I do some closing comments. Please feel free to drop them in the chat. We'll jump back into that, or excuse me, in the Q&A box. Yes, so again, just a reminder, this presentation is being recorded and will be available on our YouTube channel. I'll drop the link in here for you to check that out. We do have all the other webinars in our series for companion animals are available on our YouTube channel. Also, if you'd like to keep up on what's going on at the board and other webinars that we may have coming up, other educational opportunities, please feel free to follow us on Facebook and LinkedIn. It's a great place to see what's coming up, and also just timely information, ongoing outbreaks, stuff like that. And finally, the last thing I'm going to drop in the Q&A box here is what's available on your screen right this minute. That's Dr. Kivisto's contact information. If after the presentation you have other questions or would like to get in touch, please feel free to reach out to him directly, and we can get those questions answered. Doesn't look like I have anything else coming in. Oh, excuse me, I do. Is there a preventative that would surpass revolution that encompasses all of these items?
Not that I don't own stock in the company, but if we're speaking about cats, NexGard combo is the one that it comes to mind. It will get, it's going to get your fleas and ticks. I don't know that it's labeled for ear mites, but it's going to get them. But it also, I'm fairly certain it has not praziquantel, but a different topical dewormer in it that will get tapeworms. So NexGard combos for cats. So I'm assuming when I hear people talk about Revolution, I know they do make it for dogs, but I'm guessing you're referring to cats. Correct me if I'm wrong there, but NexGard combo, I believe it's the name, was one of my favorites before I left practice. Just for that reason, it just seemed to get everything.
It's very good to hear, Dr. Steve. It's what I use with my cats.
Nicely
awesome.
done.
I don't have any other questions coming in at the moment. Again, please feel free to reach out to us if you do have other questions. And with that, excuse me. Here we go. I keep getting to the end, and here we have one more. Excuse me. I don't have one more. Oh, no, it was just a thank you. Thank you for that, Dr. Steve, for that answer. All right, if that's all we have, thank you so much for your time. Have a wonderful afternoon, and we'll see you next time.
Thank you all. Appreciate it.